If you or somebody you know had a stroke and still has difficulty opening that stroke hand because it is tight and fisted, there might be a technique that you have not tried doing. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Most of the time when I see a stroke patient, their wrist is curled up like this. It's bent and their hand is fisted and tight. It's difficult to open. Don't get me wrong, it is the entire arm that is hard to move. It is the hand, though, that is the most difficult to regain function, to open up. But most of the time when I see a stroke patient, they are holding a rolled up towel or even a squeeze ball. When I ask them why they're doing that, they say that they're trying to regain function by squeezing that rolled up towel or that squeeze ball. But when I ask them, what's the most difficult movement that you do for that hand? I ask them, is it more difficult to open your hand than closing your hand? They would often say that it is the opening of the hand. So it doesn't make sense why you are trying your best to improve your closing or your grip strength when in fact the grip strength is already there. It is the opening the hand that is difficult. So in this video, we will be focusing on how to open up that hand and try to straighten that wrist. All right, so just follow along with me and let's get started. So the technique that I am going to show you in this video will be contract relax, which we will be applying on the wrist and hand. Now, it is most efficient if you have started mobilizing your shoulder, your elbow, and your forearm. So if you are interested in learning those techniques, just click on this card right here. So we will be applying the contract relax. So what you want to do first is start with the wrist. So your wrist is curled up like this. So we want to make this part of your forearm tired because this is where your muscles are that makes your wrist curl like this. All right, so what we want to do is to put pressure or resistance in this movement, doing this movement. So you're going to put a little bit of resistance, pushing up if your elbows are on a table, pushing up, but your wrist, you're trying to really curl it some more because we want to tire this muscle out. So curl it up, push down with your stroke arm, push it down for about 6 counts. Then after 6 counts, you're going to try to slowly stretch it up to a straighter position, your wrist to a straighter position until we can at least bend it up like this, all right? So again, 6 counts, 1, 2, 3, 4, 5, 6, and then stretch it a little bit for 15 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Don't force it too hard because again, it will rebound. So stretching, you have to hold it. Just be gentle with it. So once you are there, try again to bring the wrist back down, but provide a little bit of resistance. Again, 6 counts. 1, 2, 3, 4, 5, 6, and then stretch going the opposite direction. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, so try multiple times during the day to stretch your wrist. After you're able to at least be at a neutral position like this or even further, if you have been consistent, we will be trying to open the hand. So what we want to do is try to squeeze really hard. So this is where maybe a ball, if you have been holding a ball, you're going to squeeze it really hard, or even just without a ball, you're just going to squeeze really hard for 6 counts, and then we're going to start again with the thumb, right? So always remember, start with the thumb, stretch it to open, and then insert your 2 fingers like so, and try to open. If it can't open that much yet, we will get there. All right, so 15 counts to try to stretch to open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and keep your fingers there. Try to squeeze those fingers, those two fingers, for 6 counts. 1, 2, 3, 4, 5, 6, and then open a little bit more. Don't forget to keep that thumb stretched out. All right, so 6 counts again for squeezing, squeeze, 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 and then open for 15 counts to stretch. So before we move on to the next technique, I'm going to do the attendance check. Type down below in the comment section the word handling. So handling, we are going to handle our spasticity, our tight wrist and hand, right? So again, going back to the wrist, you're going to try to bend it a little bit more to tire this part, which makes the wrist tight and curled up, and then stretch going up towards our desired movement. So we are going to make it as neutral as possible, or even bend a little bit there for 15 counts. So 6 for the contract and relax to stretch, about 15 counts. Same way with your hand. To open the hand, you're going to squeeze hard 6 counts, and then you're going to stretch and open those fingers 15 counts. Do not pry them really hard. This is why stretching is very important. So after doing those exercises, you got to do a little bit more of the functional movements. So this is where the device that I have, this is my secret weapon with some of my stroke patients. Let me get them. All right, so this is the control, and this is where you put your hand, your stroke hand. You will need some assistance in putting this on. Ask somebody to put this on, but this is a worth it investment if you're really serious about getting better. So I don't have a stroke, I'm just demonstrating this thing. If you have somebody, please ask somebody to help you wear this glove. So this is the hand rehabilitation assistive device. All right, I'm going to put the link down below in the description area if you want to get the link for this device. All right, so make it easier for you to find out about. You can always ask or search for other devices that will suit for you. All right, so this device has a control glove as well. So if you're going to ask somebody to put this on, after that you can do your own rehabilitation, your own retraining. So I'll turn it on, and I'm going to choose the one that has some control with this other glove. All right, so when I squeeze here, it will close the hand, and then when I release, it opens up the stroke hand. See there? I am not doing that. It is just the glove. Now when I squeeze, it closes, and then I will open. So again, for this video, we are focusing on how to open the hand much better, right? Squeeze again just a little bit for 6 counts, and then open for 15. This is now where you can practice trying to hold a few things for finer motor coordination. All right, so squeeze, try to pick up a ball maybe, and then open to release. All right, so this is a really wonderful device. I don't know why I didn't know about this device before, especially when I was working in a nursing home where we were seeing a lot of stroke patients. Open to release, just like that. See how far it goes? So this is a really good device. Now again, please try to do your exercises every day. That's why we need to practice every day. The reason why, is because when you have a stroke, you're trying to retrain your brain. It's not the body that you're trying to retrain. Of course, the tightness, you have to relieve some of those tightness, but it is really the brain that you're trying to retrain. if you have any questions, suggestions, or comments, just type it down below in the comments section, and I will try to answer them as best as I can. And just also the attendance check. Remember to type it down below in the comment section. The word is handling. And a reminder, consistency is the key and never give up. Until next time, paalam.